Do you know the symptoms of the measles? According to the CDC, it takes 7 to 14 days for any symptoms to show, but then this happens. First, there is a fever, and that could spike to more than 104 degrees, a cough usually, runny nose, red, watery eyes. Then people with measles can expect tiny white spots inside the mouth 2 to 3 days after the initial symptoms begin. And then what's called the measles rash. It begins with flat red spots on your face at the hairline that spread down the neck, the chest, to your trunk. And when you have measles, those spots can become joined together as they spread from your head all over your body. When that rash appears, your fever can spike to much higher than 104 degrees. We share this information again from the CDC as a public service because our nation's public health agencies and their employees are the latest target of Donald Trump's purge of the federal workforce. And the timing couldn't be more potentially catastrophic. There is a measles outbreak right now, spreading unchecked in communities in our country with low vaccination rates. The person in charge of handling this measles outbreak, as well as the bird flu and anything else that wallops our nation's citizens and health system, is right now Robert F. Kennedy Jr. He is a person known the world over, not just for his famous last name, but as an active anti-vaccine conspiracy theorist. He was called a predator by an equally famous member of his own family. And breaking over the weekend, mass firings in the thousands all across the Department of Health and Human Services. The Washington Post is reporting that some employees are calling it a, quote, Valentine's Day massacre. From that reporting, quote, at the FDA, hundreds of staffers received termination notices. Those terminated in the food program were working on nutrition, infant formula, and food safety response, as well as 10 staff members who were charged with reviewing potentially unsafe chemicals in the nation's food supply. At NIH, between 1,000 and 1,200 people received letters as of Sunday afternoon. And at the CDC, senior leaders were informed Friday that 1,269 people, nearly 10% of the agency's staff, would receive termination notices. But Friday evening, CDC was sent a smaller list with 750 names. Now, according to the New York Times, quote, the CDC's Epidemic Intelligence Service, the disease detectives who track outbreaks all around the world, has apparently been spared because of an uproar among alumni after a majority of its members were told Friday that they would be let go. All of this is happening as experts are alarmed about a completely preventable outbreak of measles, which I just described to you, spreading all throughout West Texas. 58 cases there in the last 3 weeks. Most of them are among children and teenagers, and all except for 4 of those cases are among unvaccinated people or people for whom the vaccination status is unknown. 13 people so far have been hospitalized with measles. Across our country, measles vaccination rates among kindergartners have plummeted since 2019 to now below the level of vaccinations you need to have herd immunity. Those alarming statistics are thanks to the work of anti-vaccine activists, people like RFK, who peddled debunked theories about the measles vaccine. On the island nation of Samoa, 2 months before an outbreak there in 2019 killed 83 people. Most of those victims were children under 5. RFK has denied playing any part in fueling vaccine hesitancy there, but officials in Samoa pointed out that he met with anti-vaccine activists during his visit to Samoa. Now the outbreak here in the United States is prompting an unusual call from the conservative-leaning Wall Street Journal editorial board. They write this, quote, we are on the record as skeptical of RFK's nomination. The Senate confirmed him. Now, the best-case scenario would be for Kennedy to internalize that he is no longer an activist outsider who needs to take provocative potshots to get attention. He is the nation's health secretary, and there are children in the hospital with measles who should not have to be there. That is where we start today with some of our favorite reporters and friends. Director of the Center of Infectious Disease Research and Policy at the University of Minnesota, Dr. Michael Osterholm is back. Also joining us, New York Times health policy correspondent Cheryl Gay Stolberg is here, and host of the Bulwark podcast, MSNBC political analyst Tim Miller is here. Dr. Osterholm, it's nice to see you. Your wisdom and your face and your appearance will always harken back to the scary days of COVID. But this is a very different, I think, scary moment for parents and for families and for the kinds of things that typically don't have a partisan divide. But that is the old normal. The new normal is that parents are educating themselves about the symptoms of measles. We talk about what we understand about this outbreak.
Well, first of all, Nicole, let me just say that we're really at a point that I would call the perfect storm in this country, where we are seeing, just as you talked about, the rapid destruction, and at least surely somewhat of a destruction of the public health workforce. We're seeing a public that has a lot of very different views on vaccines today, of which they're not vaccinating their children. And then we have the viruses themselves, which today are still with us, highly infectious and capable of causing the kinds of serious illnesses you just talked about. The case in Texas is really a harbinger of things to come. It's not the norm now, but I think you're going to see more of these outbreaks like this throughout the country as we see more and more children going in unvaccinated. And of course, as we see more coming out of HHS that suggests vaccines are not safe or that vaccines are not necessary, this is a warm-up for what I'm afraid is going to be coming down the pike.
I think people whose kids are older or who maybe lived at a time when you know the vaccines weren't debated, you didn't have prominent figures in either party casting aspersion on them, so you sort of did what your pediatrician recommended, something most people still do. But I think people don't recognize that there's something between zero vaccines and all the required vaccines. And my understanding is that getting off that schedule leads to outbreaks of diseases the world over. And so can you just talk about the insidious impact of disinformation about vaccines on throwing a family with young kids off that vaccine schedule and how that exposes kids?
Well, I think that part of the problem is it is true that the vaccine schedule is complicated today. We don't want to make, mixed words about that. It is. But the point of it is it's complicated because we've never been in a better position to prevent more infections with different kinds of vaccines for different kinds of diseases. Clearly, we believe that mumps, measles, and rubella, the standard childhood vaccines, which are highly effective, very safe, and when illnesses like those occur, they can be very serious. You noted right here, 13 of 58 people in this Texas outbreak are hospitalized right now. That's incredible for young kids. And so I think the challenge we have right now is how do we reach out to parents? How do we reach out to grandparents to help them understand the safety of the vaccines, the effectiveness of the vaccines, and that if they don't get vaccinated, it's not an alternative where they will likely get infected. With time, most of these kids will know one of these infections, and unfortunately, there may be their child or grandchild that ends up in that hospital bed.
You called it the destruction of the public health workforce. Say more.
Well, as you know, right now, we're seeing these major cuts occur. You know, I'm not smart enough to know from a budget standpoint whether we need to make cuts or not in employees, but I can surely tell you one thing, without having gone to the Harvard Business School, that you don't do it this way. These are arbitrary. They are not based on what our real needs are. It's taking a machete to where we should be taking a fine surgical instrument. And it's understanding that this is also our future. We're letting go right now in many of our agencies around the government, young individuals who are the upcoming leaders of tomorrow. And I think that that's also another important point, that we will have impact from this kind of activity for a generation to come. And that, to me, suggests that you could surely fairly call this destruction.
What is we've covered the dismantling of the FBI, intentional and part of the retribution plan that Donald Trump frankly talked about as a candidate. What do scientists and doctors and public health people believe the purpose of the purge at HHS and CDC and NIH is even about?
Yeah, I don't think we really know. I mean, we all have our favorite pet theories about what is happening. But when you look across the board, I mean, all the federal agencies, I think we're going to see the spillback on these cuts over the weeks to months ahead, when we see more challenges with forest fires, and we see more outbreaks that go not only undetected, but really just in many ways neglected in a way that we would never have accepted 6 months ago. I mean, for example, right now in this country, there is a major challenge occurring with children developing influenza, developing a condition called acute necrotizing encephalitis. Have you seen a word come out of the CDC about this? They've been prohibited from even putting this kind of information out. This is critical information for parents to know. This is a serious brain complication of influenza infection, for which there are many cases out there right now occurring. Parents should know about this, so if they have children who have these signs and symptoms, get them into the hospital or at least the emergency room as soon as possible. That's the kind of thing that is very, very hard for us as public health people to watch, where we know we can do things to make it better, and we're not given that opportunity.
Can you share with us, and we'll push it out far and wide, what those symptoms are? I mean, and this has been one hell of a flu season. I've had my carpets professionally cleaned multiple times as a house that's been hit by it hard. Talk about what those symptoms are.
Well, basically, it's when your children actually, first of all, have influenza-like symptoms to begin with. That's how it starts: the fever, the muscle aches, the chills. But then there's a certain lethargy, meaning they just are a certain tiredness, a lack of consciousness, where it's very hard to arouse the children. Those are the symptoms. When they appear, you need to seek medical care immediately. And I can tell you, we know anecdotally that there are situations around the country where we have 12 children hospitalized in Boston, 10 children hospitalized at Stanford, and many other locations around the country. And the media is not covering it, and nor is CDC. And this is something we can do something about. If parents understand this occurring now and get their children in early, this surely can be a major step in helping to reduce the risk of serious illness and deaths. And as you've seen, the number of pediatric deaths right now are climbing dramatically in this country with this flu season. Parents need to understand this, and we're not doing that right now. We're not sharing that with them, and I think that's a huge, huge mistake.